Hi, this is Jessica DaMassa with WTF Health. I am here at Upgraded Life Festival in beautiful Helsinki, Finland. And joining me right now, I have Matthew Holt. He is the co-founder of Health 2.0, the founder of the healthcare blog, and also the founder of SMACK.health, which advises startups. Is that right?
That's right.
Okay. So we have Matthew here, and we're going to ask him from more of a macro level analyst perspective some of the things that he's noticed about Finland and the investment community here, the startup scene. So tell me what you saw. Give us a heartbeat of what's happening.
Sure. So here we are at Upgraded Life Festival, which is a pretty much Finnish-only festival. There's some Swedes, the odd Swede, Norwegian has snuck in here, and
there's one guy from Singapore,
and a couple of token Americans. But in general, this is the local startup scene. So this was started up by the guys from Vertical Accelerator. We started. Now it's called Upgrade. Used to be called Health Spa, which is the sort of local startup scene, very grassroots. All right. What's going on in the Finnish startup scene is pretty interesting. So if you go back to 2010, Nokia was the biggest smartphone company in the world.
Right.
What happened next was that Apple, iPhone, Nokia imploded, blah, blah, blah. A lot of unemployed Finnish engineers have been around. So what's happened is the government spent a lot of effort building a startup scene. There's been various different vertical sectors. Health is one of their big ones, and they really have pushed it aggressively. So that's why, as was announced last week, they're going to bring HIMSS and Health 2.0 Europe to Finland. They're going to try and grow that. So there's a lot of basic underpinning. Having said all that, you've got a lot of really cool, interesting new companies doing all stuff from mood rings to relaxation beds. I was lying in a relaxation bed earlier. It was very nice. All the way through to people building basic infrastructure like chatbots for mental health. I just saw one called that, and another one called SIM, and then another one called NinChat, which is like a sort of old chat communication system for hospitals. And again, most of these folks are working just in Finland, maybe in Sweden, maybe in Germany or Switzerland or a few other countries or the UK, but they haven't really grown dramatically from that. So the question really for the scene is, can they scale this thing globally and make Finland a sort of global hub for this? And that's the open question.
Okay. And do we have a bet you want to place or no?
My thought is that the problem they have is that they have a lot of initiative from the government, lots more so. In fact, I was talking to somebody about Sweden today. Sweden's somewhat cutting back on its export promotion. The Norwegians have got all the oil money. They do a fair amount of promotion. But they do have the basic problem of getting both not having a very strong venture funding base at home, so not being able to get a lot of money to grow quickly, and also sort of the getting out of Finland, getting out of the Nordics problem. Once they do that, I think there's actually some hope. And I've seen some good companies over the years, like Nuna Healthcare and Cancer, and to some extent UAP, which Nelly Lakatraman, no one can pronounce Nelly's last name.
But she's lovely.
But she's lovely. Has been doing, she's going through 500 startups and has done some global stuff. And then you have individual Finns going outside to start businesses like Sami Inkinen at Verta in the US. So you see a lot of activity in the Finns, but you're not seeing a systematic growth of sort of Finnish giants in health the way you have done in gaming, particularly, which is another strong area with Angry Birds and Roxio and those guys.
Okay, so I've heard this too. Somebody had mentioned earlier that they have, in particular with funding, it's really the smaller seed funding that they're missing. Would you agree with that?
Seems to me there are a few identified, and I've now seen them at many of the same conferences. Identified venture capitalists in Sweden, in Norway, and to some extent in Finland. Probably not quite enough. They probably need a little bit more help, I think, from some of the government funding.
Okay.
It's now Staircase, which is their big fund, is now part of Business Finland and Citra, their other fund. They probably need to be a bit more aggressive about the way they're funding. There is some decent funding. There's a lot of sort of early stage seed startup, but they need to get that sort of next jump. And I see a lot of these companies need that next, 5 to 10 million euro dollar round to get them sort of off the dime up to the next level.
Okay, the other thing that we've been kind of discerning from the interviews that we've done is that the Finns have like particular strengths, just like anywhere else, I guess you can kind of generalize. But so mobile, they're deep in that. Life sciences, they have a real life sciences bent. And then design. So we've been hearing like, the Finnish design and how that's been impacting healthcare. Would you agree with some of those things? Would you add anything to that mix, particular strengths of companies that are coming out of the Nordics or just of Finland in particular?
It seems to me that a lot of them are doing a lot of different things. There are a couple here called Medicine X, which is Medexin, I think, which has got a lot of different features that are in the American startup scene is probably 3 or 4 different companies.
Okay.
And their goal is to scale it. So I think probably pretty comprehensive applications is one set of services, and the other one is a willingness to look, very globally at things. And they do go out and look, and they've been aggressive at doing that. The question I think overall is going to be, do these things scale? you can sort of imagine having a business in one country or two countries or a group of countries, but in the end, you don't need that many international software packages, right? So you have a few dominant international global software packages in any one particular area, and that's probably what will end up in health technology. And is there room for a bunch of different ones from Scandinavia or Finland? Maybe, or they're going to have to grab together, and one or two of them may make it to the big champion.
Okay, on the flip side of this, we'll end with this here. U.S. companies coming into Finland, good idea, bad idea, and what would be your advice?
Pretty tough for the average American company to come in here and learn Finnish, localize itself.
He speaks English.
Well, I mean, literally. So the Finnish healthcare system, they're going through a massive reform at the moment. It's actually very interesting, the health system reform. It's in Parliament at the moment. It may or may not pass in the next few weeks, so we'll know probably by the time this interview goes up. And they're going to they have pretty much a British-style system where they give all the money to the hospitals and the doctors, and they're actually going to completely unplug that and give all the money and attach it to sort of these new councils, which are going to it's going to follow the patients, which will really shake up things in how they deliver healthcare. It could be absolutely fascinating if it passes. The issue is the total amount of money is 1% of the US healthcare system. So if you're an American company coming to chase this, you've got a pretty good market to stay home in, so I would stay there.
All right. Well, you heard it here. Matthew, thank you so much for providing such analysis. It's always a pleasure to hear your perspective because you've got such a good range of, well, you've been around for so long. You've got the history of everything, and then, you're so well-traveled.
Jessica, are you just saying I'm really, really old? And should
you're
put
old.
Out the pasture?
No, not at all. You're old and insightful. Wise.
Didn't you just tell me my career had crashed and burned?
I did. That was in another interview.
Previous interview. Thank you.
Should watch that one. It's cross-reference. So people understand what you're doing with SMAC.health and also how your career has crashed and burned. But regardless, we want to thank you for being here with me at Upgraded Life Festival in beautiful Helsinki and providing your analysis of what's going on here in Finland. So thank you so much, Matthew. Always a pleasure. I'm Jessica DaMassa with WTF Health.